this is sort of a little epiphany for predictability and retention. Limited treatment and retention alternative. Little sidebar. So you have a patient didn't wear their retainers, or their fixed retainer broke off. They come in and their teeth have moved a little bit. What are your options? Well, we can do braces. We could attempt to do this with aligners again. We could do spring retainers. And I think we've all seen all of the spring retainer concepts in the world. Not. Last year, someone said, hey, I want you to try these out. It's a different material. It's a beta titanium TMA flat spring aligner. I'm like, why? So just try it. Well, in my office, when we try something, we follow it. So, all right, we'll do 10 of them. Well, now we've got 120 of them, basically, for minor tooth movement. And it usually is only about a 3 to 4 month process, if that. The action on this spring is continual because it's not steel. So let's track these patients. So I'm just going to show you a couple of them, but I was impressed with the effectiveness in 3 months of that type of correction. This is more comfortable. The patient's actually going to comply with this than other alternatives. Better speech. It's adjustable. That's 1 month correction. I'll take that. Here's a lower 1 month correction. I'll take that. That's pretty inexpensive. That's pretty efficient. There's 4 months. Can you do it with any other alternatives? Sure. This is just pretty predictable. Give them a retainer. It's an insurance policy once you've done it. Because if the teeth start moving, wear them a little bit more. Beta titanium flat spring, labial, lingual, adjustable. There's 1 month correction. Do it digitally. You take a scan, prescribe, order, and deliver. You can adjust them. You can get them back in and tighten them up if you need to. But these are happening pretty quickly. Here's one in 4 months. This isn't life-changing. It's just nice, simple treatment. In fact, I'm looking at this going, wait a second. If this is working for the patients with minor tooth movement from their own issues, because their retainer broke, or their fixed retainer broke, then I talked to Neil Kravitz. I said, Neil, can I borrow these 2 slides? Because he is kind of considered one of the experts on fixed retainers. And I've kind of gotten into this, like, yeah, fixed retainers, that's the answer for everybody. But man, is it a pain in the neck to deal with broken fixed retainers. It's a pain in the neck if somebody swallows them. Or if there's the added liability of having to have a separate informed consent form, and you're married to the patient forever in some circles, they like that. Patients and dentists and hygienists hate them. So if it's a 20% failure rate, and let's say I put in maybe 500 of these, that means I got at 20% breakage and 100 repairs. And that isn't counting the number of people that might have had teeth moved that now are going to need treatment. And so I will tell you, this is only personal preference. We've gone to almost routine use of these type of spring retainers. It's putting it back into the patient's hands with a predictable mechanism that's comfortable and seems to do a good job. So consider it. It's a small lab, and they are here at the AO. Have no financial